All right, I have Sue here with me, and when she first came to me, she was dealing with some severe inflammation of the fingers with some arthritis that she had. She had a lot of difficulty closing both hands, but primarily the right hand. We've done, is it 2 treatments now? This is the third? Yep, this is the third treatment. Before she came to me today, she was smiling because she could close both hands. After the first treatment, she could close the left hand completely. The right hand was maybe 50% better?
Yeah.
25% better? Somewhere between 25 and 50% better. Today, she could close it completely. We'll get a video of that here in a moment. It's still a little bit difficult, but she can get it there. So what you're seeing right now is we have some lasers on her, stimulating tissue healing, but we also have a bunch of needles, superficial dry needling, in and around or in the joints of the hands on both sides, primarily the right side here, trying to break up adhesions and disruptions to the tissues where those tendons connect into the bone, and where those tendons are disrupted, they're not going to function as well, and you're going to have difficulty closing and using your hands. So in a moment, we're going to get a video of her with the needles out, showing her what she can do. Okay, I have Sue back with me here again, and as I mentioned, unfortunately, we don't have a video of her when she first came in, but she's an honest lady, I think, right, aren't you?
I hope.
Okay, let's go ahead and show them how you can close your fist there. And so you can see that one's pretty much completely closed. I know that one's a little more difficult still to accomplish,
yes.
right? That one feels pretty strong, right?
Yes.
Okay. Go ahead and squeeze that a few times there. And then kind of show for demonstration purposes what you could do with this hand when you first came to see me. About that much? It was super tight and painful, right?
Yes.
And now when you clench it up, it feels like it's maybe a little bit difficult, but how much pain would you say you have?
A lot less pain.
Okay. So when you first...
very minimal pain.
Okay, so when you first came here on a 0 to 10 scale, what would you say the pain was in this hand?
That was about a 9.
9. Okay. And again, this is the third treatment we've done. So, and that was like a week and a half ago that we did our first treatment?
At least.
Yeah.
Maybe
Yeah.
2 weeks.
Okay.
I don't know.
And then this one, when you first came to see me, what was the pain on this one when you used it?
It was tender, but it was less pain than the right one.
Mostly just a lot of stiffness and difficulty using your
stiff.
hand. Okay. All right. Well, we got some more treatments. We want to try and resolve as much of this as possible. Get it in more of a non-active state. I mean, we know we have arthritis that we have to deal with, but most arthritises don't need to cause pain or dysfunction. So our goal is to move you to that category where you don't have the pain and dysfunction, but we might have to manage it because it's always going to be there.
Yes.
But so let's tell people about the treatment itself. So we obviously had some needles in you, and people have a little bit of kind of tension with that. These are basically acupuncture needles. We're not doing acupuncture, but we're going after soft tissues and tendons. There's a little bit of tenderness for some of them, but not all of them, right?
Not all of them, no.
And would you say it's worth it?
Yes.
Yes. I ask everybody that, and they're always like, yeah, I was a little bit tense at first, and there was a few painful ones, but it's all worth it. Yes. So we're going to work on keeping on getting you better and better, and I'm so excited for you.
I am too.